Food for Thought on News Talk 760 WJR is presented by the Food Bank Council of Michigan, creating a food secure state. Here's your host, Dr. Phil Knight.
Today I want to begin our show by giving you three what I think to be compelling reasons why we should solve hunger in Michigan. And the first one was alluded to in our first show with Gerry Brisson, the president and CEO of Gleaners Community Food Bank, when Gerry talked about the need for national security, obesity, the unfitness to serve in the military is a great concern. In fact, there's been a report published entitled Too Fat to Fight, where the Department of Defense estimates that 75% of all young Americans 17 to 24 years of age are unable to join the military because they failed to graduate from high school, they have criminal records, or they're physically unfit. That is, they're overweight, they're obese, and it turns out to be the leading medical reason why applicants fail to qualify for military service today. Otherwise, excellent recruits, some of them who have military service in their family history, are being turned away because they're just too overweight. That's one compelling reason why I think we should solve hunger in our state. It's a national security issue. The second reason is because I don't believe we can afford it. Hunger cost. The Pyramid Group estimates that hunger costs the entire economy $461.9 billion. And of that, Mazone breaks that out a little bit better. The Jewish response to hunger, the Mazone Foundation says that hunger cost our nation at least $167.5 billion due to the combination of lost productivity per year, more expensive education because of the rising cost of education, of poor education results, also because of the cost of charity in order to do the work of hunger. So I think we just simply cannot afford hunger in our state. The third reason I think that we should solve hunger is a moral reason. And we should do that because we can do it. It is possible. This is not something that's just an impossible task that can't be done. It's something that we can actually do. And if we looked at hunger the way people have looked at, let's say, slavery, then we wouldn't do it. We would not solve this, and it's solvable. Think about Edmund Burke, who said so many great things as a parliamentarian in the House of Commons. His passion in life, his mission, was to abolish slavery out of the British Empire. And for 17 years, he introduced legislation to that effect before the House of Commons. And for 17 years, it was either not voted on or voted down. Finally, in the midst of this, after 17 years, Edmund Burke introduced legislation to abolish slavery in the entire British Empire, and it passed after 17 years. And when this happened, Edmund Burke said two things. The first thing I'm going to tell you, he said, you're all going to know. You're going to know this quote, because Edmund Burke is the person who said that all that is necessary for evil to triumph is for good men to do nothing. And when you think about him introducing the legislation that led to the abolishment of slavery, a huge social, cultural problem, yet for 17 years, he was steadfast. And after that legislation passed, Edmund Burke said these words, and I think they're more profound than his first quote. Edmund Burke said, "The biggest mistake anyone ever makes is when they choose to do nothing because they only think they can do a little." And I think that is a common mistake when we look at this big, huge problem of hunger. It's fueled by our acceptance to it as normal, by our benign passivity, or by our unbelief that it's unsolvable. But I simply do not accept that. And I don't think our colleagues, I don't think the general population, I don't think any of us, when we put our minds and hearts together and pull together to create food security across our state would have any different results than what Edmund Burke did as he confronted this huge social problem. I'm convinced, folks, that hunger is not bigger than we are, hunger is not better than we are, and hunger is not beyond us to solve. This is Dr. Phil Knight, and you're listening to Food for Thought. We're going to take a quick break and come back with Paula Cunningham, the CEO of AARP here in Michigan, to talk about the effects of food insecurity among our senior population. Thanks for listening. Come back and be with us.
Welcome back to Food for Thought. Once again, here's your host, Dr. Phil Knight.
And in the studio with me, Mr. Gerry Brisson, who is the CEO and president of Gleaners Community Food Bank. And he's also the chairman of the Food Bank Council of Michigan Board, which makes him my boss. So
Only in so many ways, right?
Yeah. Gerry,
great to be here, Phil.
That's great. Great to have you back on the show. Look, we want to dive right in here because we have Paula Cunningham, who is the CEO for AARP here in Michigan. And Paula, welcome to the show, and thanks so much for making time to be with us. And folks, if you don't know Paula, you really should, because she is a philanthropist, a business leader, a community advocate, and a great friend and supporter of this mission to create food security across our state. But Paula, your emphasis is really about seniors as the leader for AARP, and we know that food security has increased and gotten better generally, but it hasn't for seniors.
Absolutely, that's very true. And first, just let me thank you for the work that you're doing to bring this food insecurity issue to the forefront, even in a more profound way than it has been in the past. And you've been working tirelessly in that effort, and we all very much appreciate that. And even though it does impact, all parts of our population in different segments in different ways, the food security issues for seniors it is exacerbated by a lot of different issues. One might be their inability to have access to food because they're not driving. They might be at home, staying at home. Some of their illnesses also, where they have chronic heart disease and a heart failure or a diabetes and needing more fresh foods. They just impact seniors in different ways.
Absolutely. Well, I know that Feeding America, our national organization, and AARP nationally are working together to create some initiatives to address senior hunger. And I know that this is passionate for you, and you've led some great efforts. Even during the Flint water crisis, you've been at the forefront working there. And I'm just wondering, what are some of the thoughts that you have and where we're going to go to help solve senior hunger across our state?
Well, it's different. It's very different. I'll tell you, when you talk about it and intellectually you study it and you know that it's an issue versus going door to door and talking to seniors and seeing the impact that food insecurity has on their lives, which we were able to do firsthand in Flint. Not only were a lot of our seniors impacted by the water crisis, but their inability to have access to food. The AARP Foundation has put some dollars behind certain communities to help. Actually, it's called a Fresh Savings Program that the foundation has in terms of just trying to help bring more fruits and vegetables into the homes of seniors to have them have more access. And they're showing that when the right types of programs are implemented, that it can make a difference. But that's just the tip of the iceberg. There's so much that continues that needs to be done in there.
In our work here at Gleaners in Detroit, one of the things that we find that's actually quite moving about seniors is no matter how hungry they are, they often feel someone else needs it more. And it's one of the things that just you go in. One of the volunteers actually that came to Gleaners told us about going to his own grandmother's house opening the cupboard, seeing there's no food, and saying, "Grandma, there's no food here." And she's like, "Well, don't worry about me. Somebody else needs this more." How much do you think that plays into just the issue of trying to reach seniors with food?
Oh, I think that's just a cultural thing. We're as seniors, and I am one. We've always been taught to take care of our children. That's our responsibility. It's what we've seen role modeled for us. As we were growing up, I think all of us, to some degree, our parents want to make certain that their children were provided for, and there's some embarrassment attached to that if a child doesn't have any food, and it's just part of innate in being a parent and being a mother or a father. And seniors will want to make certain that their children are healthy, that they're learning. And we know children can't learn if they're hungry.
And it's so hard for all of us to say we need help. I mean, it's one of the bigger things that we face at every level, but especially with seniors, to say, I could use a little help, and it would matter for me, if I have diabetes or heart disease or something. So we see this as such a critical issue.
And no question. And it does impact all parts of our region, all parts of demographics, young, old. It doesn't really matter. Children are falling asleep in the classroom, or adult men are standing in line at a soup kitchen, or seniors are lined up at a local supermarket because the grocery store is giving away day-old bread. We see it across the spectrum, and no one really wants. That's not the kind of life they want to live. We know it's an issue, and we need to, actually build a coalition to really help our policymakers and others look at hunger as a major health issue.
Well, I think you're exactly right. I mean, it is one of the social determinants of health, food insecurity is. And Paula, I know that the AARP Foundation has helped to create a resource guide and toolkit for people in the medical field as they're screening their patients for food insecurity, particularly for seniors.
Absolutely, and there's lots of information about that on the AARP Foundation website, but that is part of the commitment as well. AARP doesn't, people often think of us as insurance and, discounts, but there's so much more depth and breadth to this phenomenal organization that takes care of or tries to help assist all aspects of a senior's life. And seniors are defined as 50 years old, so it's not your 70 and 80-year-olds necessarily. And as you know, the older they get, the more challenging it is for older adults, particularly, to have access to the type of food and nutrition that they need.
Well, Paula, we have about 30 seconds left in this segment, but I realize that 1 in 5 adults that's over 50 struggle with food insecurity. And I have to thank you for leading efforts in Michigan to help create food security among our senior population.
Well, we appreciate that and very much appreciate the work that you're doing, getting fresh fruits and vegetables in Detroit and other parts as well. And again, there's more people than you know suffer from this. So those who are listening, we hope that they will all join forces and do what we can to help. And thank you so much for the work that you are doing. Thanks, Gerry and Laurie, as well.
It's our pleasure. Thank you. That's Paula Cunningham. She's the CEO for AARP here in Michigan. I'm Dr. Phil Knight. Gerry Brisson's with me, and we'll be right back on Food for Thought.
It's Food for Thought with Dr. Phil Knight on WJR. Get in touch with the Food Bank Council of Michigan. Visit fbcmich.org. Once again, here's Dr. Phil Knight.
Gerry Brisson, my co-host here, is with me. He is the CEO and president of Gleaners Community Food Bank. And today we have with us in this segment Laurie Solotorow, who is a senior program officer at the Michigan Health Endowment Fund. And Laurie, you guys are doing some great work addressing senior hunger across our state. Could you tell us about it?
Absolutely. Thank you, Phil. So a couple areas of focus of the Michigan Health Endowment Fund. We fund primarily in the interest of seniors and children within our state, and one of our proactive funding areas is nutrition and healthy lifestyles. So pinpointing your comment about seniors and hunger, there is a great need out there, and the fact that some seniors are being underserved in terms of food access and food security security is something that is of utmost importance to us, not only in, some of the funding decisions we make, but also as we think long term how to minimize that situation in our state. So lucky for us, our state has an extraordinary network of senior service providers. And, just a kind of a fun fact, those providers provided more than 10 million meals last year alone, so which is wonderful. But even with all that work, there are still quite a few people in the thousands who are on waiting lists for critical programs like Meals on Wheels. So because we're a statewide funder and because, we have that priority both on nutrition, food access, and older adults, we really think about that as we formulate our programs and work to form partnerships with these organizations who are doing great work throughout the state.
Wow, that's awesome. So I know, Laurie, that from our previous conversations that food insecurity has dropped overall, and we talked with Paula Cunningham in the previous segment, the CEO for AARP, but it hasn't dropped for older adults. And, obviously we're concerned about that, and with our new emphasis on data and how we're able to see these trends, it's going to help us be able to address the need now that we understand where the need is at. So how do you think that this is going to affect the priorities of obviously the Michigan Health Endowment Fund, but I wonder if you have any insight about if you saw that as a trend going across other giving organizations in the state. I guess I'm asking how interested, what's the temperature about food security for seniors across the state that you guys are seeing?
So that's you teed my next comment up beautifully, Phil. Thank you so much. So as I mentioned earlier, we're a statewide funder, and so we as we came to be and as we grew, what we did is partnered with an organization and conducted a scan of the top 40 health funders in Michigan around numbers of areas of focus and priority areas where a lot of the funding was going in our state. And shockingly, at least it was shocking to us, we found that only 3%, and that's the number 3% of those philanthropic dollars went specifically towards senior services and programs. So that was really, really surprising to us. And so as we think about, our funding priorities, I think one of the things, as you mentioned, Phil, it doesn't seem to be, the things that have been done from a food access perspective haven't really moved the needle. I think one of the reasons for that, I'm not sure if Paula mentioned it in her segment, but, Michigan is aging. We're the 10th oldest state in the nation, and by the year 20,
I didn't know that.
Yeah, but by the year 2030, 25% of our residents will be 65 or older. So this is something I think that it'll be an uphill battle for us. But one of the things in terms of our funding priorities and the areas we're looking to support, as I mentioned, we've had a number of conversations with numerous organizations to really help us better understand the needs and the challenges around food access and food in general, but specifically for those who we would categorize as older adults or seniors. And so we're looking to kind of understand, what are some of those root causes of senior hunger? Is it, lack of availability? Is it, not too many affordable options for these folks? Is it transportation or social isolation? And so I think one of the things that was an aha for us is that we don't always think about social isolation as a reason for senior hunger, but it's a very significant factor because if people are homebound, they don't have access to transportation or other services, they don't have that food readily available. So one of the programs we just funded that we thought was extremely innovative, it's a pilot through Henry Ford Health System, and it's an initiative to look at more innovative ways to address social isolation using postal workers, so a partnership with the U.S. Postal Service such that they can check on older adults, help them get connected to services they may need like Meals on Wheels or support from a food bank. And we're really excited to see this pilot launched. It worked well in England, and Henry Ford is looking to see whether or not that can be, that can help address some of that social isolation piece.
There you go.
Here in Metro Detroit.
Awesome.
I like it that you're talking about Henry Ford Health Systems and healthcare in general, because at Gleaners we believe too that the way to reach seniors, or we're coming to believe this more, is be where they are, and even socially isolated seniors have to find a way to get to the doctor and occasionally to the hospital, and so how do you find yourself where they are so that you can get them those critical things that they need, and then of course how do they get it home? Right. I mean, and these are some of the things that hospitals are already having to deal with. And if they already have to solve the problem, they're smart people. So partnering with hospitals is, I think, one of the keys to solving this.
Absolutely.
I couldn't agree more, Gerry, because if you think about who do these folks generally place their trust in? They trust the recognizable individual who delivers their mail every day. They trust, their local health care provider, whether it's a hospital, as you said, Gerry, or even their physicians. So meet them where they're at and align ourselves with people that they trust.
And when we started talking about these things, one of the things we said is there is hope. There are answers. There are solutions. And this is a concrete example of what we're talking about.
Mm-hmm.
It is. It absolutely is. And that's where I think, pulling off of our first show on Food for Thought, where we introduced the idea of bringing data into our process and to our work so that we know exactly where they're at. And the mapping project that we're doing with Grand Valley State University and Dr. Steve Borders, all of this is going to help us, and this information that it brings to us is going to lead us to innovation. We've got about 2 minutes left in the segment here, Laurie, and I want to make sure that we're covering exactly what the Michigan Health Endowment Fund is able to do for seniors who are struggling with food insecurity.
Well, I think the opportunities for that, Phil, are really limitless. There are so many opportunities for partnerships and support of good work in the state that we, quite frankly, are just incredibly excited about seeking out and being able to help in some way. As we think about what folks need in the state regarding food security, I would say unequivocally that older adults and seniors in the state are always top of mind for us. It's very easy to think about children in the sense of food access and food security. We see billboards up around the state. 1 in 5 children goes to bed hungry every night, and those are alarming and very unsettling statistics. But at the same time, I think we could easily say that about older adults in our state. So from a funding perspective and from a partnership perspective, we have two proactive funding areas, healthy aging and then also nutrition and healthy lifestyles, that are really, hopefully, from our part, going to facilitate a lot of that good work that's happening in the state. And, whether it's just expanding services that are already working. I mentioned in the beginning of our segment about, the wait list for critical programs like Meals on Wheels, and also supporting initiatives that Gerry spoke about just a moment ago with meeting seniors where they're at, helping to better understand what is it they need from their community and from those around them. And I think that's one of the major things that we're extremely excited about as we move forward with our funding efforts. If you would like more information about the type of projects we have funded, or more importantly, our future funding priorities, you can visit the Michigan Health Endowment Fund's website at www.mhealthfund.com. There's quite a bit of information around our grant cycles, our grant requirements, and the types of funding we're looking to do in the future.
Laurie Solotorow, she's the Senior Program Officer for the Michigan Health Endowment Fund. Laurie, thanks for being on Food for Thought with us today, and thanks for all of the work, the great work of the Michigan Health Endowment Fund.
Thank you so much for having me. I really enjoyed the opportunity to talk about this very, very, very important topic.
Great. I'm Dr. Phil Knight. You're listening to Food for Thought on WJR. Come back and be with us.
You're listening to Food for Thought with Dr. Phil Knight.
Gerry, I think we have to kind of set the table here. And we know that about 16% of the people who live in Michigan are food insecure. That's across all sections, across all counties, geographical, every people group, about 16%. We know a little over 20% of children in the state are food insecure. That works out to be about 1 in 5. Ironically, that's the same ratio as it is with senior hunger that Paula Cunningham was talking about from AARP. So with that as the table is set there, I'd like to get your thoughts and reactions.
I think we're a lot smarter about these numbers. Even the fact that you can rattle off some statistics about who's hungry is a significant change over what it was when I started in this work 30 years ago. So we know a lot more about who's hungry, and we have help from the National Food Bank, Feeding America, who really, does good research. And actually now every county in Michigan is mapped with an estimate of how many people are food insecure, don't know if they're going to have enough meals all the time, right? They're reporting that they don't get enough meals every day. So what we know about the 5 counties we serve with our good partner Forgotten Harvest, who does awesome work as well, is that between the two of us, we meet about half the need. There's 700,000 people who are food insecure in the 5 counties of Southeast Michigan. And between the people we see and what we can give them, we meet about half the need today. Now, that's something to celebrate on one hand. We're meeting half the need. On the other hand, we're meeting half the need. Right, yeah.
Yeah, exactly.
So the innovations that we discussed earlier in terms of how do you reach seniors and how do you reach children, that's what we have to continue to develop so we have better ideas for that next half.
So we're doing a food security analysis across the state from the Food Bank Council of Michigan. I think your example of your service area in the 5 counties is a great example. I would just jump in here to say that my gut tells me we're probably doing that across the state. Doing what? Meeting half the need.
In every community, and that's surprising to people because most people like to peg the problem in an area. Like this is a problem for the urban centers in the state.
Right.
But in fact, rural poverty is a tough challenge. It's hard to get to people, and a lot of the social systems that might be in place in urban areas just aren't in place in rural areas. So there's a lot to consider when you start looking at that next half.
Well, both of those issues, urban and rural, have access challenges, but those access challenges are defined differently.
And are going to be solved differently.
They're going to be solved differently, exactly.
So having the support of AARP and the Michigan Health Endowment Fund is going to be critical in this. And they're supporting not just what we're doing today, but innovative ideas for how we can get to that next half.
Well, exactly. And we're going to do an entire show in a few weeks about innovative ideas that we're launching to try to scale to meet this need. But when we talk about the meal gap, you used that term a minute ago. I think for me at least, unpack that a little bit.
Yeah, so we know that different people are in different circumstances and really do have quite different needs depending on their employment situation and how many people are living in their household and all those sorts of things. But on average, a food insecure person is missing 3.5 meals a week. That's the average. So that's just over a day a week that they're not eating. Now, those days kind of bunch up at the end of their month usually.
Right.
And with the fixed costs they have to pay, whether that's rent or transportation or childcare or whatever their costs that they have no control over, the only thing they really have left at the end of the month is their utilities and their food. That's really what people have to play with. And that's why when you get a flat tire and it costs you $10, well, what are you going to do? You're going to eat less, and the meal gap comes from that. Primarily, it's something that's changed. It might be a small thing on average, but when you're not quite making ends meet. Those small things mean not enough food. That's
Right.
really how it works out the majority of time.
And I like the point, too, that you make, because I think this is true, because I say it like this: people end up with more month than they do money. And that day, a week or so, 3.5 meals that they're missing that ends up completes a day, they kind of all come together in the last 10 days of the month.
Right. And
so now missing a day a week doesn't sound so bad. Missing 10 in a row, that's something else.
Yeah, and how does that affect the rest of your life? I mean, the stress level that happens when you are in that situation is enormous.
Yeah.
Not just the actual physical feeling of being hungry all the time, but the guilt, the sense of failure, the other things that compound as you miss more and more days of food because you're just not getting it together. So it's a tough situation, and I think the other part of that is it's solvable, and it's not so expensive to solve that we can't figure this out.
No, it's true. I've heard you say before, what's cheaper than money, and for us, it's food.
Right, indeed. And we have access to lots of different kinds of food, and it's a matter of now let's identify who this next half is and how to get the food to them. That'll give us a cost, and then we'll go get the people that win when this is solved, and that's how you're going to get this done.
But I do think the point as we close out this segment here needs to be made that if you're meeting half the need, that's something to be celebrated. It's something to be celebrated, but it also presents a challenge, and it's going to be very difficult to scale charity to meet the second half of this need.
It's not going to be all charity. This is going to take different, innovative ideas about who wins, who actually does better from a business perspective when this is solved. So if education wins, we all know education wins when hunger is solved. We know healthcare wins when hunger is solved. We know businesses win when their employees don't come to work hungry. We've got to take that to the next level and say, this is how much you win when you solve this problem.
I think we can do it, and we'll do it together. Dr. Phil Knight here on Food for Thought with Gerry Brisson, the CEO of Gleaners Community Food Bank. You're listening to Food for Thought on WJR, and we'll be right back.
It's Food for Thought with Dr. Phil Knight, presented by the Food Bank Council of Michigan. Once again, here's Dr. Phil Knight.
Gerry, I got to tell you, Gerry Brisson, the CEO and president of Gleaners Community Food Bank, the two ladies that we had on, Paula Cunningham and Laurie Solotorow, I'm going to do a very dangerous thing here. I'm going to ask you exactly what you think, because I know that you're going to be able to pull some gems out of what those ladies shared with us about the dangers of senior hunger across our state.
Yeah, you know what I think first is there's people out there who are really smart, who have resources, who care, who are bringing other people together, who are really smart, who have resources, who care, who know that it's in their best interest to solve this problem. And we're not talking about, your average nonprofit here. We're talking about thought leaders who are working across the spectrum, right? They're working with businesses. They're working with hospitals and health systems. They're working with obviously people who can and want to and know they need to fix this problem. So that as a backdrop says to me, that's why we can do this. And that's what I think about what they said.
Yeah. I thought it was really encouraging, inspiring even, to talk about all these systems that it's almost just like we need a conductor to bring these systems together, and we can accomplish this goal. And I think that's really one of the reasons we're doing this show on WJR, Food for Thought. So find that place where these people are great at what they're doing. Let's get in there and get them to do that with the people that we're serving.
Well, and you're a great conductor, Phil, if I can throw that into the show. I mean, the Food Bank Council of Michigan, which is the statewide organization responsible for keeping a finger on what's going on in this area, that's what you run. That's the work you're about. And as the chair of the board and on behalf of the other food banks working with you on this, we're proud of you and real happy to support you in what you're doing to be the conductor.
Well, thank you. I said I was going to ask you what you thought. I didn't know it was going to be that dangerous, but I appreciate your kind thoughts there. But I do think after listening to Laurie and listening to Paula and listening to your thoughts, this is doable. And not just for seniors and not just for children like we talked about in our first week show, but it's really doable to solve this hunger problem, create food security for everyone across our state, whether they're seniors or children and everyone in between.
Yeah, we can't afford not to, right? And we're going to hear this over and see it over and repeat this over because fundamentally it's a cheap problem to solve and an expensive problem to live with.
Yeah, you're exactly right. The economic impacts are as we talked about in the monologue, it's staggering the amount of money that we're spending on not solving hunger, And then, I don't think we can afford it economically, but I don't think as a nation, and we talk about our security, I don't think we can afford that either.
Absolutely right. And that's why we're so passionate about this work. That's why we keep at it and why we know you people listening, you're going to be with us because it doesn't take much to get to that place. Once you see what people are capable of doing, you just say, okay, let's do that then.
Yeah, it's doable. And I think that's what we want to do in this show is we want to change that conversation. We want us to talk about what's possible. So great having you on the show. Thanks so much. Gerry Brisson, the CEO and president of Gleaners Community Food Bank, a thought leader in this industry nationwide. Thank you, Gerry.
It's my pleasure, Phil.
Great. So, folks, I want to give you some food for thought here, and I'll stretch it all the way back to my monologue in the opening of the show here, and just share with you that as I travel across the state, as I work with these 7 leaders of the regional food banks across the state, as I listen to folks like Laurie Solotorow and Paula Cunningham from AARP and Michigan Health Endowment Fund, I'm inspired, I'm encouraged, and I'm excited. And I'm convinced more than ever before that hunger is not bigger than we are, hunger is not better than we are, and hunger is not beyond us to solve. But we'll need you to come alongside of us too. This is Dr. Phil Knight. You've been listening to Food for Thought with Gerry Brisson and myself, heard only on WJR. Thanks, and don't forget to tune in next week.
Food for Thought has been presented by the Food Bank Council of Michigan, creating a food-secure state.